Hello, everyone. We are going to be talking about the topic of fertility or getting pregnant, right? It's a very complex topic. It's not just doesn't only involve our mental and physical state, but also our relationships with a partner, and that can get a little messy, right? So what I wanted to do was we wanted to bring a success story on efficacy of acupuncture for getting pregnant by Dr. Denise. Dr. Denise has over 27 years of experience. She is one of the top fertility specialist acupuncturists in the country. So welcome, Dr. Denise here.
Well, welcome. Thank you so much.
Okay, so we'll just get started a little bit about learning about you and your personal journey, specifically in fertility.
I just came upstairs. I have two kids, so I guess I did have a success. I have a 19-year-old and a 24-year-old. But back in the day when I was trying to get pregnant with my second kid, I found out I was a carrier of a genetic disorder called Tay-Sachs, and it's fatal for the baby. And so I thought, oh, that's never going to happen to me. But lo and behold, I got pregnant, and then I miscarried. And then 3 months later, I got pregnant again, and I had this Tay-Sachs genetically abnormal kid that I had to terminate. And then I had a really difficult time getting pregnant. And I thought it was just going to be really easy. And I struggled and went to specialists and tried everything. And I couldn't even enjoy the moment. I was very stressed. And ultimately, I ended up having to look at my relationship to myself, my relationship to my partner, and got a lot of help in managing stress and getting my cycles regular. And then I conceived my second child. That's why they're 5.5 years apart. But in that process of like a lot of anguish, I realized, and I was also an acupuncturist, that my passion was to really help women to connect to themselves and their partner and to, really connect to their fertility.
Okay, so I mean that's and I know that you wrote a book, right? Really bringing all your experience of 27 years. So tell us what exactly the book is about. And I know that you talk about sexual relationships, which is sometimes can be very difficult to talk.
Yeah, in my practice with working with hundreds and thousands of couples, I kept finding that people wanted to talk to me about sexuality, and they really had nowhere to talk about it, and they didn't really know what to do. Like I would have patients where the man wouldn't be able to ejaculate in the woman, and they had to do IVF, but nobody gave them a solution. And couples were talking about the baby making sex and how horrible it was, and I just found myself saying that there needed to be a book written that really talked about intimacy, sexuality, what it means to open up your heart and drop it into your reproductive organs and make a baby. So I wrote this book, Conceiving with Love, which also talks about Eastern medicine and Chinese medicine and goes into depth about even Ayurvedic medicine, different ways to look at the body, mind, spirit.
And the goal, what is the goal that you think?
I think the goal is really to make each individual whole, really to maximize your body, your mind, your spirit. And that sometimes means looking also at your relationship, your relationship to self, how healthy you are, but it's not just that, right? It takes two to make a baby, even if you're doing an IVF or you're using Western reproductive medicine. I find that, then you have the baby and the whole relationship is not doing well. And I see that also. So this idea of repairing the sexual relationship, helping a woman get confidence in her body and in her ability to make a baby, and men as well. And also reclaim the intimacy that sparked the desire to have a child in the first place is really, I think, is the beauty of really bringing the love into the equation, because sometimes it gets lost on temperature taking and what to eat and what vitamins to take. And while those are important, it's not, it's not everything, right? It's the combination of everything.
Absolutely. And it's become such a big thing, right? Infertility, it has been on the rise if you look at in the last couple of decades, as opposed to our parents' time frame.
Yeah, it's really, I'm seeing girls in their 30s with issues like they're not ovulating and all sorts of stuff. And, there's a whole environmental component that we need to address. So I look at all those components when I'm looking at people. And when I did my program, I looked at Eastern secrets from every which way. And I started with understanding the sexual anatomy and the physiology of desire. And I can tell you, my patients that are going through this program, because I give it to them, they are I didn't know that it was located there, or they're reading my book. Like they didn't know about this topic because we're not really taught in school.
Yes. And then I know the sexual anatomy and physiology of desire. I mean, it's a very complicated topic. So in the sense like, you know, the desire is something like either you feel attracted to someone or not. How do you bring such a complicated topic in your program is what I want to understand.
I love that question. I spent a lot of time, you know, I got certified as a sex coach and really trying to understand different people's models. So it's not my physiology of desire that I made up. It's actually people have studied this and have written about it and different theories. And physiology of desire for women is much more complex. And women will tell me all the time, like, my sex drive is really low. I have really low sex drive. I don't want to have sex at all. And when I start explaining them about what desire is and what arousal is, and that it takes like 30 to 45 minutes of foreplay to become aroused sometimes, and then a woman has desire, they're like, they didn't know any of that. So it is complex, and I share different people's theories and research that's been done.
Sure, and that's why going out and having a nice dinner, and you know, that's important because it starts like lighting up the mood, right?
Yeah, right. It starts. I would say like it's all day foreplay. Starts in the morning. Yeah.
Oh wow. Okay. So to all the women out there, you know, all of we women need a lot of time to get attracted to someone and get aroused, right? That's the bottom line here. We're talking.
Absolutely. It takes time. Don't expect it to like turn on in a minute.
Okay, not like men. Okay, so the second part, you talk a lot about in your program about natural medicine, right? So tell us a little bit about that.
So my background is Chinese medicine, and what we do is we use these ancient techniques of using acupuncture, acupressure, having people do like self-massage, and herbs and diet. You know, these herbs have been around for thousands of years, and women have used them to help their bodies regulate their menstrual cycle and increase fertility. And Western medicine is fabulous, and I work a lot with Western medicine doctors. And this is a piece they don't learn in school, like naturally how to maximize your body for not only intimacy and increased desire, but fertility. It's the same thing, right? So yeah.
Yeah. And then Chinese medicine, right? It's quite complex. So why do you think understanding the Chinese medicine, the 5 elements, is critical specifically for fertility?
Well, I think really it's a great background for understanding how our bodies work, because our bodies are complicated. And the 5 elements, actually in each element, there's an emotion, there's an organ system, there's a color, there's a taste, there's a season. And it really helps us to put a framework into our own bodies, right? So right now, let's say we're going into summer. We're going in wood transforming into the fire element. So wood is just because we're in wood element right now, the spring, you know, it's new growth, new fertility. It's the visionary. It's able to vision the future and create what you want. It's like we're planting seeds right now. We're getting the soil fertilized so we can plant seeds. And that metaphor is really good for our body. So if we, and in Chinese medicine, the emotion of the wood when it's not in balance is frustration. And it could be anger. And we feel frustrated, our energy constricts, right? So the idea of learning these elements, learning our bodies, it gives us another way to understand how our body works in a circle, that it's not just one thing. And it's like, it's not just focusing on the ovaries only or the sperm only. It's focusing on the whole being. And that's what the Chinese medicine 5 elements gives us.
No, I think that makes complete sense. And then you also talk about natural medicine versus conventional medicine, right? The IVF and other things. So where are the similarities and what are the differences?
I mean, natural medicine is really, I mean, even if you're going to be doing Western reproductive medicine, I think it's great to maximize the body. It takes 70 days to make sperm. It takes about 60 days or to go through the growth cycle of the follicles that contain the eggs. And we want to maximize the follicular fluid that nourishes the eggs. And natural medicine with herbs and nutrition and exercises, like Qigong exercises, helps us, breathing helps us to decrease stress and also get our bodies prepared, even if we're trying naturally, right? So the idea is pregnancy preparation, and natural medicine has that component, where Western medicine is like, their toolbox is like, let's go, let's do an IVF, it's best statistics, or let's get you on medicine. And some people, sometimes if there's even issues like non-ejaculating, not being able to ejaculate, and then people like turn to IVF. There's sometimes some natural fixes that people just don't know about. So this is, they're both good, natural and conventional medicine.
Sure. And then before we actually go to the stress reduction, do you want to talk a little bit about efficacy of acupuncture, specifically for fertility, right? I saw that there's a lot of research that has already been published as well. So you want to talk a little bit about that?
Yes, when I started acupuncture 27 years ago, the needles were like experimental. And now it's been researched and proven that acupuncture helps, increase blood flow. It increases endorphins, your body's natural feel-good hormone. It helps with the sympathetic nervous system, decrease the sympathetic nervous system. There's research, and that's what we want. That's the sympathetic nervous system, is the fight, flight, freeze response. And this is like heading into our topic of stress, because when we have that fight, flight, freeze response, we're not getting blood flow to our ovaries, it's going to our adrenal glands. So natural medicine can help, acupuncture specifically, and acupressure and a lot of things can help decrease that sympathetic nervous system. So it's a really beautiful thing.
Sure, sure. And then the stress, as you mentioned briefly, is stress reduction techniques are very critical, right? If you're trying to conceive a baby.
Absolutely. We all have stress, right? Today's day and age, there's so much stress, more so than I've seen in a very long time, just because we're all living the whole, the planet. It's not just where you're located. Everybody has a sort of sense of stress like they've never had. And it's important to find a way to be able to interact with that. Stress is we need a little bit to function, but when it gets too much and it starts impeding in your ability, the body's saying, no, it's not a good time to conceive. Too much stress, not a good time. And so we've got to work with that, right? It's like not a good time to make a baby if you're kind of like if you're barely existing. So it's a balance, right? Learning how to live with the unknown, uncertainty, in a way that we take care of ourselves.
Sure, sure. It's interesting how our bodies can put a stop, like a stop gate here. Okay, I'm stressed out. Don't even come near me. I don't want to make a baby. You know what I mean?
Yeah, it's so true. It does get in the way of so many things. Couples sometimes they work so much and they're so stressed, they don't even have relations. They don't have intimate relations because they're too stressed. That happens too, right? When actually having more intimacy would actually decrease the stress hormones, right? It brings up good oxytocin, and those are really good for you, but people don't feel like that. So it's interesting. Humans.
All right. So moving on to the stress reduction, what Dr. Denise just said, we have Ellen Otts. Ellen is an international stress relief expert. So Ellen and I actually have been working together for the last 1 year. So I welcome Ellen. Ellen, namaste. Is she joining us?
Hello, namaste.
Where are you from? Where are you joining us from? I'm sorry, I don't know where you're joining us.
Today from Holland. I'm back in my home country. Yeah, for a short period of time. Yeah, all right. So thanks for having me. My personal journey with stress management has been a big one. I think a journey that hopefully I think a lot of people can relate to. I think I have been struggling with anxiety for quite a long time when I was younger, but the sort of peak in my journey started when I was healing from sexual trauma, so quite severe problems there, which ended up in PTSD and in burnout. And of course, burnout doesn't happen overnight. It's stress that has been accumulating and me fighting against the, let's say, stream of my body, the stream of my mind and my emotions. So of course, that has been piling up for years. But what I noticed is that I didn't get my period anymore. I had asthma. I went to the hospital with, I think, a list of 30 different complaints or ailments, I must say. And of course, they couldn't find anything. At that time, I was a journalist and I was a manager in a risk management company, so quite complicated jobs. And I would say I had turned it to a more masculine part of myself. So very head-based, very mind-based, very go, go, go. And I didn't feel connected with my body at all. So I was just looking for ways. I started this whole journey that, in a way, Dr. Denise was sharing as well, of a more holistic approach to life, a deep journey into my own psyche, into my own spirit, into my body, and to just see what was working and what wasn't. So then I sort of completely transformed my life into what I thought was important. So I became a yin yoga teacher, which basically is a yoga form where you allow the body, where you stop, where you pause, and where you give yourself permission to just feel it all. And I started quite a big journey into spirituality, into holistic medicine, into just applying my journalism into more holistic approaches. And now I'm sharing that with others. And I feel for women, especially, very much how important it is to really be a woman, to be in sync with our cycles, to be in sync with our bodies, to connect with our womb, to connect with our emotions, and to actually allow ourselves to be a woman with everything that it entails. And I think so many women like myself back in the days, especially in the big cities, are hardened, and we have some sort of anxiety to be more soft. And that's on a more deep level, the work that I'm sharing right now, besides being a stress relief expert and a coach and a mentor and all those kinds of things. So that's my journey.
Sure, sure. It's a beautiful story. Do you want to walk us through a teeny bit of sneak peek at your stress relaxation technique now, or how would you like to do that?
Yeah, I can give an introduction. So on the 5-day program that I've created, I tapped into my own needs back in the days, and also from working with so many clients, I know how difficult it can be to actually find something that really works, and to find, because there's so much out there, I call it a relaxation jungle, so that can even create more anxiety. So what the intention of my program was to give a full packed program that's really aimed to activate the parasympathetic nervous system. So that part of our system that allows us to heal, that allows the body to recover, and to give people different techniques. So working with the breath, for example, but also a body scan or an ancient technique of yoga nidra, but also a very gentle yin yoga flow based on Chinese medicine, by the way. So it's sort of like a complete package, so that people don't have to think anymore of what works, but they can just sort of dive into the program that I've created based on my own experience and from other clients, and just sort of dive into that and let yourself be taken by those restorative practices. So yeah, I can tell a lot about it, but I would say the main goals are to reduce anxiety, to connect you with your body, to stimulate the kidney energy, so lots of restorative energy there. Breath work that works, on the one hand, works on upliftment, but also works on reducing anxiety and reducing stress, improving flexibility. We will work on the hip joints, so very important for women who try to get pregnant, of course, and lots of calming the nervous system, because I think what is important to if we only make time for the body to stop, to pause, then the rest eventually will come, because the intelligence of the body will know what to do. We just have to make time and do the right practices, and put the body in a position where it's about yin yoga and restorative yoga, where the intelligence of the body is being stimulated and the parasympathetic nervous system can take over, and the restorative energy can just flow through the body and heal us, really. So we just have to make time for that.
Sure.
So that's what I did. So day one is a very gentle yin yoga flow, working with the kidney energy, working with back bends, but in a very gentle way. And I explain a lot, so people don't have to have experience for it. And then the day two is anxiety reducing breath work, but also I'll give a breathing exercise that's really uplifting. And then the body scan is a technique from mindfulness, one of the most easy to do techniques that really connects you with your body and with the sensations. So many women may feel that they don't know what they feel anymore. They feel desensitized or numb in their bodies. And a body scan is really good for that. And then a restorative yoga is very good to calm the body, to calm the mind, and to put it very simply, to just do nothing and let the body restore itself with lots of props. And then Yoga Nidra is a very ancient technique, actually. That's one of the most effective ways to reduce tension, and not only tension on the physical level, but also tension in the mind. And most of the tension ultimately stems from the mind. So Yoga Nidra is a very effective way to release that on a very deep level. So I try to just give a full package of, okay, what really, really works based on my own experience, based on science as well, because the journalist in me really wants to offer stuff that really works. So I combined all of that in a very nice stress relief program that I think will be very beneficial to connect with the body, to allow, to pause, to recover, to heal, and to be more feminine ultimately.
Thank you so much, Ellen. So do you want to give us a small demo of a small meditation, like for 1 minute, I don't know, whatever time you think, couple of minutes?
Yeah, let's do an on-the-spot gentle meditation to connect with the lower parts of our body, so the pelvic floor and the hips and the lower belly. And I'll do that. So you can do that however you're watching, whoever's watching. If you're lying down, that's completely fine. If you're sitting down, perfect as well. But close your eyes and just loosen up the shoulders. Any other stretches that allow you to sink into the body, please do them. And if you're sitting, I'm inviting you to plant the soles of the feet firmly into the floor. Take a deep breath in. And as you breathe out in the direction of your pelvic floor, the lower parts of the body. Another deep revitalizing breath in. And as you exhale, exhale out any tension that's in your body right now. And a final deep revitalizing conscious breath in. And breathe out and then just allow yourself to ground. To connect with your body from the inside out. And bring your awareness to your lower belly, your abdomen. And become curious of what's going on in your lower abdomen. Any sensations that you can feel there. And if you can't feel anything at all, that's completely fine too. But have a sense of curiosity, of openness, of intimacy towards these lower parts of your body. And then bring your awareness to your pelvic floor. Your womb. Just very simple, very powerful. Just send a few deep healing breaths there. As if you're using your breath to breathe in new life, new love into these precious parts of your body, of your being. And then notice what happens. Just with your mind's eye, scan your lower abdomen, your pelvic floor, your womb. Is there anything that you can notice there? Any sensations? Maybe feelings that come up. And can you just for now allow yourself to feel those things, whatever it is that you're feeling, that you're sensing. And just sending a few more loving breaths into this area. Sending softness to these precious parts of yourself. And as you exhale, imagine that you exhale tension. Whatever it is that is causing tension, just exhale it out. And again, with your mind's eye, scan your pelvic floor, your hips, the area of your belly. Bring your right hand to your lower belly. Just start to breathe into the back of your hands and just feel your hands on your lower belly. Just that. Just connecting with your lower belly. With your second chakra, your center for feelings, for your sensuality, your sexuality. But just for now, just allow yourself to just connect with this part of yourself. And then bring your left hand to your heart. And with a sense of allowing and openness, maybe appreciation for this amazing body that you have. Just take a few revitalizing, loving breaths here. And know that, trust that your body will respond. The moment you take some conscious time to reconnect with this gorgeous, amazing body, with the sensations, with your feelings, with your breath that always anchors you, not only in your body, but in this very moment. And then all together we take a final deep breath in. From our hearts to our belly and back to our hearts. And as you breathe or sigh out, open your eyes.
Beautiful, absolutely beautiful, Ellen. If anyone has any question, I see people watching on FB Live. I know stress reduction. I mean, we are talking about pregnancy and conceiving a baby. here, and stress reduction is in context to that. But overall stress reduction to what's going over in the world right now, especially in India, all of us need stress reduction techniques. And this particular program that Ellen has put together can help you really with the stress relief. And that's what that's what our goal was, to bring you the programs that are not only affordable, but bring some value to it, to your life every single day. So any questions anyone has? Okay. So what we are introducing our programs, like we said earlier, these are very affordable programs with the goal that we are bringing the best of the best experts from all over the world to you in a pre-recorded videos with group Q&A sessions. So, and we price them very affordable as well. The first program is by Dr. Denise. She talked earlier, she explained her program. And she is an expert, like a fertility expert, who has put together this beautiful program for men and women, couples who are trying to get pregnant and understanding, how natural medicine can help you. So that's our number one program. That's priced at less than $200. The second program is a stress relief program. That's a 5-day stress relief program that Ellen has put together based on her experience as well as her expertise. And it's very affordable. It's like get into your rhythm on a everyday basis for 5 days. I've started doing that every single day to help me calm myself down. So I think this is what we are trying to bring. So any questions, any comments, any feedback, you're welcome to ask us now or later. Anything you'd like to add, Dr. Denise or
No, I think it's awesome. I think the combination of these programs together are amazing. Yeah.
Yeah, absolutely. And the idea was to, how stress relief is so critical, right, for conceiving a baby, to your point, where you were mentioning. So we thought it'd be really good to offer a comprehensive solution rather than one as a standalone. Okay, so if there are no more questions, you can reach us. We've written our website, we've written our email. We will be sending the details to everyone who has registered for this particular session today. And yes, anything else, Ellen, you want to add before we wrap up?
No, just I agree with Dr. Denise how awesome this combination of these two things is, and just how beautiful it is. So thank you. I love it. Thank you.
Me too.
Absolutely. Well, thank you, everyone. And our hearts are going out to India, everyone in India. We are praying for all the people in India. I am from India, so I have a lot of family back in India. So I did want to say that. But overall, we are bringing these affordable programs to you. Please let us know your feedback, how you feel about our company, how you feel about us educating you and empowering you with that. I'd like to thank you so much to Dr. Denise and Ellen for joining us today.
Thank you so much.
Thank you. Thank you.
Thank you. Thank you, everyone.
Bye.
Bye-bye.